So the next presentation is a presentation with the title Search for Multifunctional Ligands Aiming at Symptoms and Causes of Alzheimer's Disease.
Thank you very much. Good afternoon. I would like to thank the organizers for enabling me to take part in this conference. Today I'm going to talk about search for multifunctional ligands aiming at symptoms and causes of Alzheimer's disease. To start with, I want to say some facts and figures about the disease, but I want to also to stress the fact that it is a very serious healthcare problem, as there is no disease-modifying therapy of the condition, which is responsible for about 70% cases of dementia, and there are nowadays more than 46 million people worldwide affected with the disease. And as you can see on this cartoon, Alzheimer's disease causes death of neurons. It is a neurodegenerative disease, and what's more, it is a multifactorial disease. So there are many factors involved in its pathogenesis and development. And in this highly complex network of events associated with the disease, there are very many theories which try to explain the cause of the Alzheimer's disease. And I decided to choose most important theories. These include amyloid theory, cholinergic theory, and neurotransmitter theory. According to amyloid theory, the main cause of the disease is amyloid beta, which forms senile plaques. And this theory suggests some possible targets which could be used to decrease the levels of amyloid beta, and these include enzymes as beta secretase. The cholinergic theory is the oldest one, and it was developed basing on the observation that the neurodegeneration occurs mainly in cholinergic neurons, in the brain areas involved in memory and cognition. And traditional therapeutical approach is blocking cholinesterases, so enzymes which are responsible for hydrolyzing acetylcholine, which is a neurotransmitter in cholinergic neurons. And the neurotransmitter theory is very general. It states that there is an impairment in many neurotransmitter systems in the brain, and one of the possible targets is 5-HT6 receptor, so the serotoninergic type 6 receptor. As I said, Alzheimer's disease is a multifactorial disease, and scientists know that it is very efficient to treat such diseases by acting on several targets simultaneously. And normally they do this by administering a drug cocktail to the patient. But you can also use another strategy called multifunctional ligand strategy, where you create a molecule on purpose which is designed so to interact with more than one relevant for the disease targets. For example, target A and target B, or target B and target C. And one can ask the question whether there is a justification for the use of substances which interact with many targets simultaneously. And there is justification indeed, because there are some very effective drugs used in the therapy. For example, clozapine, which is used in the treatment of schizophrenia, belongs to the group of atypical antipsychotic drugs, and it is antagonist of 5-HT2A receptors and D2 receptors, and also it is able to interact with many other receptors, thus providing very effective therapy on the disease. But I want to stress the fact that it was not developed as a drug which will address many targets. But the strategy of multi-target directed ligands is that we do on purpose molecules which will be able to interact with many targets. And here is a success story of ladostigil, a molecule which was designed and synthesized by mixing pharmacophores from two known drugs, rivastigmine and razagiline. And this led to the molecule of ladostigil, which is able to interact to block cholinesterases and monoamine oxidase B. And in fact, this drug was tested in clinical trials. The last one was in 2017, where this drug was tested in phase 2 in patients with mild cognitive impairment. Now I'm going to talk about research which we are performing in our department. And recently we described a series of compounds targeting butyrylcholinesterase, beta secretase, beta amyloid, and tau protein. And now I'm going to talk about the design of the compounds. We took a known beta secretase inhibitor. We took a compound which was designed and obtained in our department, a dual-acting acetylcholinesterase and beta secretase inhibitor. And we stated that there is a pharmacophore containing benzylamine moiety and hydroxyethyl moiety, which will be responsible for interaction with cholinesterases and beta secretase. But we also wanted to endow these molecules with some additional properties, namely to interact with beta amyloid and tau protein. So we performed virtual screening because we wanted to search for some fragments which will endow these molecules with additional properties, and we selected these fragments. And actually, we succeeded. We obtained a series of compounds, from which compound 10 was very interesting because it showed a balanced activity profile in vitro. It was able to inhibit with micromolar range of activities. For example, beta secretase, the enzyme responsible for the formation of beta amyloid. Beta amyloid in the Alzheimer's disease tends to aggregate. This compound was also able to stop this process, also to stop the process of tau protein aggregation. Acting on these three targets, this should provide disease-modifying effect when using potentially this compound in the therapy. But it also offered some symptomatic treatment, as it was able to alleviate the cholinergic transmission impairment by inhibiting butyrylcholinesterase. I want to stress the fact that it is for the first time such compound was described in the literature, such compound combining 4 activities in single molecule. And we believe that maybe one day it could be a part of an effective treatment of dementia. The next project, which I'm going to talk, which was also performed in our department, was based on very nice results from clinical trials where patients were administered a drug cocktail containing donepezil and idalopyridine. Donepezil is a known acetylcholinesterase inhibitor, and idalopyridine is a known 5-HT6 receptor antagonist. And patients who were administered this drug cocktail showed enhanced improvement of cognitive functions in phase 2 trial. But as we all know, it is not so easy to administer 2 drugs simultaneously because there can be some issues connected with pharmacokinetics and pharmacodynamics. So we thought that maybe it would be reasonable to create multi-target directed ligand combining these 2 activities against these 2 targets. And we also succeeded. We obtained a series of compounds, of which this shown here was the best one. It showed a balanced profile of activity. It was a nanomolar, in the nanomolar range of activities, an antagonist of 5-HT6 receptors, inhibitor of cholinesterases, both human acetylcholinesterase and butyrylcholinesterase. And because we obtained such positive results in vitro testing, we decided to perform in vivo testing, and we proved that this compound was able to have a cholinomimetic effect in vivo, and because it was able to decrease the locomotor stimulation induced by scopolamine. So to sum up, I want to say that we believe, and many scientists believe, that the treatment of multifactorial diseases would be very beneficial when using compounds which are able to, or therapies which are able to interact with many targets simultaneously. And the strategy of multi-target directed ligands seems to be very promising, reasonable, and as you can see, it is possible to obtain on-purpose molecules which can interact with more than one target. Thank you very much for your attention, and I want to also say thank you for many great scientists with whom we are cooperating in this project, because it is an interdisciplinary project. Thank you very much.
Thank you very much. Any comments?
Not a comment, a question. Any prediction of
When it comes to blood-brain barrier penetration, it is very important because all these drugs should act within the central nervous system, and we perform testing with using the PAMPA test to check whether they would be able to pass this membrane. And these compounds, which I shown here, were able to pass through this barrier. And in case of in vivo testing, it also is a proof that for the fact that they are able to cross this barrier. When it comes to pharmacokinetics, we haven't performed any studies, but when it comes to physical-chemical properties, we try to optimize them, and for the compounds with this unique 4-target profile, they were tested using some computer available programs and online available, and they showed a very positive profile when it comes to the physical-chemical properties. So,
any expected side effects?
I
said expected because I understand it's a very, very early stage of discussion about the drug.
Yes, it is early stage. So of course we are assuming that if we go further with the research, there won't be many, but there is of course a risk of such interaction. But we are performing research on a quite basic and early step. So, no.
Thank you.
Thank you.
Thank you very much. And the last presentation in the session, magnetic resonance imaging and spectroscopy in preclinical studies on neurodegenerative ocular diseases.
Good morning, everyone. My name is Michał Fedorowicz. I want to thank the organizer for this very nice opportunity to present our results. I will start with a short introduction. So, blindness and visual impairment is really a huge global problem. Almost 1/4 billion people live with vision impairment or blindness. And while the majority of these causes of vision impairment are cataracts that are currently easily cured, there are still more challenging diseases of sight that have currently very limited treatment options. These are mostly glaucoma and age-related degeneration, the two diseases that are in fact neurodegenerative diseases. I will mostly focus on glaucoma as an example. So glaucoma is impairing the peripheral vision, and finally it leads to very extreme narrowing of the visual field, so-called tunnel vision. There are around 80 million people affected worldwide, and around 20 million of these people are blind and binocularly blind because of the glaucoma. What is important is that most of the cases of glaucoma, over 90%, are slowly progressing. This is mostly so-called primary open-angle glaucoma, and this also means that most of the people doesn't know that they have glaucoma. Some estimates say that even 50% of people doesn't have a valid diagnosis. The treatment options are currently pretty limited. It's in fact only the lowering of intraocular pressure, and it's also a huge economical problem and huge market for the anti-glaucoma medications. Right now, it's estimated that the global market for IOP lowering medication would be $8 billion in 2021. So as I said, glaucoma is in fact a neurodegenerative disease. It was formerly believed that it's a very simple disease, that the key mechanism is an elevation of intraocular pressure because of impaired drainage of the aqueous humor, and it simply leads to mechanical damage to the optic nerve and the bodies of the retinal ganglion cells. In fact, the mechanism is far more complex, and what is key in this disease is neurodegeneration of retinal ganglion cells. It is now known that the neurodegeneration is not limited to the optic nerve, it's not limited to the retinal ganglion cells, but it's also affecting other parts of the brain, visual cortex and nuclei connected, associated with vision. And it is still not clear what's the meaning of this extraretinal degeneration in the pathogenesis of glaucoma, but it seems that it could be crucial for the current for the future treatments to target this degeneration outside the retina, and also to monitor it in when we think about future therapies. So our project was aimed to track and characterize this extraretinal degeneration in glaucoma, in fact in slowly progressing glaucoma, and to create an experimental setup that could be in future used for testing new anti-glaucoma approaches. Our studies were mostly based on magnetic resonance imaging with this system, 7 Tesla Bruker biospec. And we used a mouse model of glaucoma. This is a pretty old strain of mice, DBA2 mice, that carry these 2 mutations. And as a result, they display iris pigment dispersion, and the debris for the pigment is blocking the outflow of the aqueous fluid. So as a result, they develop an age-dependent elevation of intraocular pressure, and they may serve as a mouse model of glaucoma. So as you can see in this graph, the elevation of intraocular pressure is pretty moderate. It's like 50% few millimeters of mercury. What was striking on the first look, that the intraocular pressure difference was not evident in the older mice. So also you can see when the disease starts, the pathological process would start around 6 months of age. When we looked at the eyes of these animals, we saw that there are evident signs of intraocular pressure elevation. In 6 months old animals, you can see that the anterior chamber of the eye is deeper than before, and in the control animals. And you can also see that in older animals, these morphological changes in the eyeball are even more pronounced. So the whole eyeball is longer, and the anterior chamber is extremely deep. We wanted to check if this IOP elevation would affect the brain and when it will start. So for this reason, we employed so-called atlas-based morphometry. So basically, we acquired high-resolution MR images of the brain, of the whole brain. We made some pre-processing, tissue segmentation, and finally we were able to label the regions of the brain and calculate automatically the volumes of selected brain regions. And for example, you can see that the volume of visual cortex was lower in the glaucoma mice, and the process started pretty early, just as we noticed the first signs of the intraocular pressure elevation. And that was not the case, for example, for the primary target of RGC axon, the superior colliculus, the extrastriatal structure connected to vision. We wanted also to look for the mechanism and for other signs of neurodegeneration in the visual cortex. So we employed a technique called localized magnetic resonance spectroscopy. So basically we selected two voxels of interest. One was control frontal cortex and the other was the visual cortex. And we acquired spectra that served for calculation of so-called metabolite concentration. So the substances in the brain that could be detected by MRS and are more or less in millimolar range of concentration. So as you can see, there is no apparent difference in N-acetyl aspartate that is believed to be a marker for neurons, and this is consistent with human studies. But on the other hand, there is a late increase, a late difference in the taurin concentration that is believed to be a marker for astrocytes. And also what we saw, that there was pretty early difference in the glutamate concentration. So it was much higher at the very beginning of the disease in the glaucoma group. Another mechanism that we looked at was the deficits in the axonal transport. For this, this is a common mechanism in various neurodegenerative disorders, and we wanted to check when this appears in our model of glaucoma. So quickly we employed a method that is called memory. This stands for manganese enhanced magnetic resonance imaging, and its principle is relatively simple. Manganese is MR visible. It acts as a contrast agent, and it's also transported along the axons. So it could be an MR visible marker of axonal transport. So we basically injected a solution of manganese chloride into one eye, and then we allowed some time for manganese to be transported to the brain. And what we expected was to visualize the primary targets of the retinal ganglion cells axons. So in fact, these two structures, LGN, lateral geniculate nucleus, and superior colliculus. And as you can see, the manganese really reached the superior colliculus and also the lateral geniculate nucleus that I don't show here. And in control animals, the enhancements was relatively stable. It was more or less the same in all the age groups. But when you look at the glaucoma group, it appears to be a bit less prominent, and you can see that in old animals there is no enhancement at all. So to get some numbers from this, we adopted a method for quantitative evaluation of axonal transport with memory, and it showed us that first of all there's an early difference at 3 months, so it's even faster than we observe any changes in intraocular pressure. And of course, at 14 months, at the advanced stage, there's a complete failure of the axonal transport. And what is also important is that we can say that the axonal transport failure in these mice would not be the reason for this, for the axonal transport failure would not be only the loss of RGC cells. For example, in the 14 months old, the mice with advanced glaucoma, you can still see some enhancement within the optic nerve. So you can see that there are still some living RGCs, and they still take up the manganese, but they cannot transport it. So to summarize my talk, we showed that it's feasible to show extraretinal neurodegeneration by MRI in a mouse model of glaucoma. And what is really essential is that the pathological changes could be demonstrated at a very early stage of the disease. And we believe that this workflow could be used for evaluation of even very advanced therapies, for example, based on stem cells or neuroprotective or novel neuroprotective agents. I would like to acknowledge my collaborators. And finally, I want to say thank you and invite you to collaboration with our laboratory. Thank you very much.
Do you have any questions to those people?
It's extremely late. It's the last one.
So in this patient, it was interesting that on the first slide, or in this one of the first slides, in this animals in the 14 months, you demonstrated there were no the wall of the thickness of the wall was still relatively high, but the pressure was not so high.
Yes.
So how you can explain that?
There are at least two explanations. One is that it's compensated by the volume of the eye, and the second one is also that the measurement itself could be affected by differences in corneal thickness, for example.
Have you had any studies with optical computerized tomography?
No.
The thickness of the wall of the retina?
No, unfortunately not. But it's feasible to visualize retina with our method. We've got some measurements on this. Of course, it's not this resolution are in OCT, but it's feasible.
Okay, I think most of us are.
Thank you very much.
Tired. Thank you very much for your presentation. Thank you very much for your audience, for your interest in the session, and we have now time for there is a break. Another one. Yes. Okay, and the flash talks later on. Thank you. Bye bye.